Wellness Wednesday. It's Kelsey and Shelby here, and we are continuing the month of November in celebrating National Diabetes Month. So today we wanted to introduce you guys to another one of our diabetes educators, Amy Turley, who is a registered nurse and also a CDE. So today Amy is going to be telling us a little bit more about gestational diabetes. So our first question for her is, what is gestational diabetes?
Well, gestational diabetes is a type of insulin resistance we sometimes see in pregnant women, usually in their second trimester. It's caused by pregnancy hormones, which makes the woman more insulin resistant. So it's not that she's not making insulin, it's just that she's not able to use it effectively. And her sugars will continue to go up until the baby's actually born, and then a lot of times they'll drop back off again.
So what does this mean for the baby?
Well, there's certain risks for the mother and the baby. For the mother, the risks are preeclampsia and having a difficult delivery. For the baby, we may see a larger than normal size. They sometimes have respiratory issues. They may have jaundice, and a lot of times they can have a low blood sugar after birth.
So how does a woman find out if she has gestational diabetes?
Well, the American Diabetes Association does recommend that every pregnant woman gets tested for gestational diabetes between the weeks of 24 and 28 weeks of gestation. How they will do this is with an oral glucose tolerance test, and that just means the woman usually comes in and she's fasting. Then they'll do a blood draw. She'll drink a very, very sugary drink, and then they'll test her blood again at a predetermined time.
I think I've heard of those before.
Yeah. So what will the woman have to do if she is diagnosed with gestational diabetes?
At that time, she usually has to test her blood several times a day in order to make sure that her blood sugar levels are not elevated. Her doctor will also prescribe a certain diet and exercise recommendations for her during the pregnancy. Some women will require medication. Usually that medication during pregnancy is insulin, simply because it is safe for the baby and the mother.
So what happens after the baby is born?
A lot of times the woman's blood sugar will go back down to normal. Sometimes it does stay elevated, and that woman may need medications long term afterwards. Usually those are just oral medications though. She also, even if her sugars are low, needs to see a regular physician at least once a year to be tested, because she's at an increased risk of becoming a type 2 diabetic for the rest of her life. And as far as the baby goes, the baby is also at an increased risk of becoming a type 2 diabetic. So you want to make sure that the child remains active and does eat a healthy diet.
Great. Well, thank you, Amy, for so much information on gestational diabetes. If you have more questions about gestational diabetes, or if you have questions about your own diabetes, don't forget that we have diabetes educators here at the health park. You can get a referral from your doctor to see one of those to ask any questions, to learn all you can about how to manage your diabetes. And don't forget to tune in next Wellness Wednesday, where we're going to talk about even more things about our diabetes during Diabetes Month. And we hope to see you guys next week on Wellness Wednesday, your place to get well, one bite at a time.